In early 2016, I lost my partner to fentanyl poisoning. Finding a path to find help is not easy. Having the barrier of stigma, having people judge you is so scary. And that's something as a society we need to work on to remove that, because if people are able to access help, if they are supported, then the chance of them getting better and living their life to their full potential becomes a very real possibility.
I started off smoking cannabis and drinking in my youth years. For me, I didn't know that I was addicted until like 8 years later. I started realizing, and it wasn't even like a thought or like a possibility that I could get off of drugs. I really appreciate harm reduction because that's how I got clean and sober. Harm reduction gave me like advice and kind of just like a realistic environment where I could be myself around like normal people who understood me. It's pretty cool to have my life saved or turned around from this model. So we're all people, we're all human, we all deserve to be treated equally.
So I work at Calgary Alpha House, which is a detox center. It's a social and medical detox center here in Calgary. Regardless of what socioeconomic status the folks we see are coming from, poverty or people in the middle class or those who are working poor, middle class, whatever, folks are coming in feeling very shameful, definitely.
I've had a lot of pain issues through my life, injuries, that kind of thing, and somehow in the back of my mind I made it okay because it wasn't a real addiction, so to say. I was taking it for medical purposes and really let it get out of hand. Hardest one was my daughter. She never gave up. And so that means that I can't either. And it's been 4 years, 4 months, and it still bugs me. But like I said, my daughter and my family, if it wasn't for them, God, I couldn't imagine what it would be like trying to get through this shit without any support.
The Supervised Consumption Service in Vancouver, Insight, has responded to more than 3 million visits and 3 million incidents of drug use, over 6,000 overdoses, and they've never experienced a death in their facility. So we know that supervised consumption services do save lives, and they do provide people with an opportunity to live another day and to have an opportunity to make some different decisions in their lives when they're at a point where they're ready to. I think one of the most significant things to come out of this opioid crisis, and one of the most significant things that we can do, is to change the narrative around who's using substances and help to decrease the stigma around substance use. The stigma and shame that people experience when they have a substance use disorder is significant, and it prevents them from accessing services and from speaking to their family members and friends about their substance use. And when you're sitting in the shadows, that's when you're the most at risk and when you experience the least amount of safety. So if we can support people to understand that substance use affects everybody in every community, then we can start to change that narrative and really support people and increase people's dignity and self-respect, and that's the best way that we can combat the overdose crisis.